Hi, I'm Kareem Salhiyyah, a consultant cardiac surgeon. One of the commonest questions that we get these days is which is better, a surgical aortic valve replacement or replacement through the catheter by a TAVI procedure? We've discussed before about aortic valve diseases and the need for valve replacement. We also talked about the different methods for replacing the valve. Through surgical aortic valve replacement, this is commonly done these days through minimally invasive approach, where part of the chest is opened and the patient is placed on the heart and lung machine. The old valve is removed and cleaned and a new valve is placed and secured. In the TAVI valve, this is done through a catheter, which is a long wire that gets inserted through an artery of the body. The catheter is placed on a balloon and it's passed with the catheter until it reaches the site of the old narrowed valve. The valve is then inflated over the balloon and which will attach itself to the sides of the old valve. In order to differentiate between these two methods, we should follow scientific methods and research. The studies should compare between the short and the long-term outcome of either method. However, this is generally speaking also based on an individual patient assessment and risk. So comparing between the two methods, surgery involves making a little cut to the chest in order to get to the heart. This involves staying in the hospital a little bit longer, usually 4 or 5 days after the operation. The recovery from surgery is somehow a little bit longer, depends on the occupation and the nature of the patient. In the TAVI or the catheter valve, there is no need for opening the chest or placing the patient on the heart and lung machine. The stay in the hospital is less, maybe 2 to 3 days, and the recovery is usually quicker than surgery. Comparing the risks between the two procedures, the risk from surgical valve replacement is low and it's usually about 1% or less. The risk from both surgery and TAVI depend on the patient characteristics as we discussed. But in general, the risk from surgical AVR is about 1% or less, while the risk on life from TAVI is about 1 to 5%. The risk of a significant stroke in surgery is 1 to 2% compared to 4 to 5% in TAVI. In surgery, the need for a permanent pacemaker, which is a little machine that regulates the heart beating, is low and it's about 1.2%. This is higher in TAVI and it goes up to 5 to 17%, depends on what valve is being used. In surgery, there is cleaning of all the calcium from the valve, and the valve is usually secured nicely. Therefore, the leak of blood from around the valve, or what's called paravalvular leak, is extremely rare, while this remains a major problem in the TAVI valves. A minor leak or regurgitation is about 30 to 35%, while a severe leak is about 1 to 5% in the TAVI valves. Studies have also shown that improvement in heart muscle and its return to its normal dimension is much better in the surgical valves compared to TAVI. Also, there is a significant difference in cost where the TAVI valve is substantially more expensive than the surgical valve replacement. In addition, there are some general complications that can occur equally in the surgical aortic valve replacement or the TAVI. Finally, the decision to choose one or another is a patient choice, but according to the guidelines of the International Heart Societies and Organization, this should be done through a heart team, a team that's specialized in this technique and can discuss with the patient the pros and cons of each technique after fully assessing the patient condition and deciding the benefits on the long and short terms. And we wish all the patients health and well-being.